Welcome to the Your Company Health podcast. I'm your host, Andrea Wright, founder and CEO of the Wright Consult Digital Marketing Agency, and also the creator of the Patient Buzz program. The goal of this podcast is to highlight healthcare professionals, their journey, and how they're making the world a better place. Let's dive in. Welcome to another episode of the Your Company Health podcast. I'm your host, Andrea Wright. And today we have a special guest, Mr. Qiao of Moving Analytics. Shuo is the co-founder and CTO, and also was selected to the Forbes 30 Under 30. Hey, Shuo, how are you?
I'm doing great. Thanks for the invitation. Happy to be here today.
Thank you so much. And it's a pleasure that you're here because we want to talk more. As you know, this podcast is about, highlighting healthcare, individuals who are in the healthcare space who are making a difference. And we know you and your company, Moving Analytics, are making a difference. So first things first, I know your mission is to conquer cardiovascular disease as a leading cause of death by empowering people with tools to adopt a healthy lifestyle. So talk to us about that.
Sure, of course. Not just in America, it's in the world. Cardiac-related disease is the leading cause of death. And just shocking to know the fact that a lot of people know that's the leading cause of death, but people are not doing enough to prevent that from happening. The way we're trying to conquer that and prevent that is give cardiac patients enough education, enough guidance, so that they will be able to recover from cardiac disease with the help of the care manager and the experts, so that they don't get readmitted right away. They don't get readmitted after a year, things like that. And our goal is to prolong their lifespan so that they can have a couple more happy birthdays, with their family, things like that.
Yeah. And as you know, your heart disease, that's a silent killer. They call it the silent killer. How do you do this? What are some of the tools and strategies that you use?
Sure, of course. The problem we are solving is after heart attack, after the patient gets discharged from the hospital, they don't get enough care for the patients at home. They don't know what to do. They don't know, what kind of guidance they have to follow. And for us, we build this home-based cardiac rehabilitation program, and so that we can give the guidance, help the patients at home. And the way we deliver it, we offer a patient-facing app, mobile app, and we also have care team-facing web dashboard, so that the patient and the care team can communicate between them, so that care team can deliver everyday goal for the patient, so they know what to do. Usually, how we construct the patient home cardiac rehabilitation prescription is combination of exercise, nutrition, and medication, and some education content, and emotion management material as well. So it's all combination of that. And if the patient is smoker, so we also have some smoking cessation guidance for that as well. So it's just combination of different things to improve the patient's health. That's how we deliver it.
So talk to us about access. If a person with heart disease would like to reach out to your company, how could they access this and be a part of this program?
That's a great question. Right now, we work directly with providers and payers, so that if you are one of the group, you will be notified inside the group that they will let you know, Moving Analytics is one of the partner that work with them, and you can get access to our program, I think either free or with a really low copay. That being said, we are also thinking about to make it public accessible, that patient just can purchase on their own. But that probably takes some time because, we have to make it into the roadmap and deliver it and, think about the business model there, things like that. But definitely that's something that we are planning to roll out as well.
Right. So this sounds like it's something that you partner with the provider. So talk to us about the partnership with providers.
Sure. What's amazing is for the provider and payers, they all have the goal to make their patient more healthy and reduce the admission rate. so that it's good for the patient, also good for them to reduce the cost of operation, things like that. So they have the motivation to work with us. So they're willing to pay us and cover the cost for the patients to deliver this care. And they cannot do on their own because the major focus in the hospital settings, it's hard for them to reach patient during, when the patients are at home. So that's where we come to play and partner with them. Right now, we have really, I would say, seamless experience. And how it works is usually the provider or the payer identify the patient that going to get discharged, and we get notified that, hey, this patient potentially be a good fit for our program, and they get referred to us. And then we examine the patient profile and say, this patient's eligible or not. After we found the eligible patients, we'll get consent from patients, and if they agree, we'll enroll them into our program. And how it starts is we collecting the basic demographic information from the patient, set up the care plan and care schedule for the patient, and then at the same time, the patient will receive a box of rehab kits by mail, and inside the box is everything they need for home-based cardiac rehabilitation. They're gonna get a wireless scale. They're gonna get wireless blood pressure monitor, and they also get a resistant band for some exercise. And they also get training materials that they can read. Things like that, all included into one box. They also get a activity tracker. And that's all included. They just open the box and put it on, and they can start the rehabilitation right away at home. And once in a while, every day they have daily, kind of tasks they have to meet, in the sense of they have to record their vital signs so that their doctor, their care team know how well the patients are doing. And if they have questions, they can chat with the care team, things like that. And there's exercise goals, there's education goals, things like that. And so that, it's gonna last usually for 3 months. Usually the patients see a, significant health improvement.
So you mentioned the app. The provider would have access to that app and see that information about the client, correct?
The provider will have access to our web portal, where they will be able to see the aggregated information of different patients that they are managing, so that they can, manage a lot of patients at the same time.
Right. As what you mentioned, this can definitely help the patient, because the provider would have access to vital information to know how to proceed with a specific patient. So this is great. Do you take insurance, or what type of insurance do you guys take?
We just started this pair model, I think, starting some time last year. We just rolling it out, and we are trying to expand to more providers and pairs. Right now, the pair we work with around New York area. And insurance company we are working with is called CDPHP. We are talking with bigger pair organizations as well around New York area and Pennsylvania area as well, and definitely we are expanding that reach for sure.
So basically, from what I'm hearing, you right now is really the larger clinics, but you haven't reached to like the private practices as yet.
I don't think yet, but that's definitely our roadmap that we trying to reach soon.
Right, and this is great. And so Shuo, I know we are talking about what you movement analytics does, but I want to take a step back, and I want to talk more about you. So I want you to tell us your story and how you got into the space.
I grew up in China and did my undergrad in Beijing, study engineering. And during my undergrad, I had the chance to exchange for a 1-year program to India. It's called IIT Madras. That chance, I go to IIT Madras. I study there and meet my co-founder first time there. He already in the US, but he was working on a school project when he was in the same school. And I was basically introduced by the professor that, continue his work. And that's how I get introduced to him by the professor. And, we know each other. And I met him when he came back to India once. His name is Harsh. He's our CEO. And when after the exchange program, I also applied for the US university that I got into USC. He's at USC as well. So I met him again. And also I met another co-founder, Ade, who is from Nigeria originally. And, three of us just want to do something together. And Harsh and they already have the idea and starting some activity tracking company. And, we just starting work together. And then after, a while, we working on the activity tracking company. And we thought, oh, this is not a good business model for us at that time. And we decided to pivot to healthcare. And we found just motivate more people to exercise is huge benefit in the healthcare domain. And then, that's when we make the decision to pivot to cardiac rehabilitation. I think that make more impact in the society compared to the previous work that we are doing. And then we just did the pivot and, we keep working on this ever since. So, yeah.
Yeah. That's fantastic.
Yeah.
And so when did you guys start the company?
It's long back when we were in school. So it's around 2013. Harsh and they started, and I came to US 2014. We started working on the activity tracking kind of subject at that time. And then we made the pivot around 2015.
2015. How many employees do you have at this point?
We have close to 50, 60, close to 50 now. Actively hiring, try to reach 60 soon. So
you have a presence still in China or just US based?
Just US based at this moment. It's talking about expansion. Definitely want to expand more. And as you said, the insurance coverage, also do more outreach to other states as well. And in terms of next step for international expansion, probably, Europe or Canada would be, first choice if that happens soon. Yeah, that's definitely, what we're thinking there.
Right. And I was doing my research and seeing what you guys are doing. But talk to us about the range of your services. I know we speak specifically on heart disease and what you guys are doing, but give us an overview of all your services that you offer.
So this basically two types of services we are providing. And the first type of service we are providing is purely software, right? The hospital and payer can just purchase license from us and they can use our software. We can do a training for them. They can use our software to manage their patient. This model is widely adopted by one of our partner, Kaiser Permanente. They are using this model for quite a lot of patients in their hospital to efficiently manage their patients compared to what they do previously. So what do they do previously? They don't have a really good software. They basically just make calls to the patient, follow up, give instruction. That way it's less efficient. Ever since they work with us, they improve their workflow and they see even higher adoption rate, things like that. So that's amazing to have this business model with them. And second business model we offer, or service we offer, is instead of just providing software, we also providing service of managing the patient on behalf of the provider, on behalf of the payer, so that it's kind of one-stop solution, right? So for the hospitals, they just let us know, hey, this patient need cardiac rehabilitation. They refer the patient to us, and then we check whether they're eligible or not. We get patient consent. Then that's it. We take over the patient. We talk to the patient. We give them the guidance. We help them to install software, and we send over the kits for them to measure, their weight, their blood pressure, things like that. And for a minimum of 3 months, all the patients the payer need to see is, oh, this patient is like healthy and not get reduce their readmission rates. That's what they want to see. And we provide this kind of one-stop solution for them.
And that's great. Mm-hmm. And let's talk about success stories or patient outcomes. Do you have any numbers, like percentage of people who actually use your product and, they're, you say, better off? Like, do you have any numbers to say if someone is listening that, you can say, 60% of our client base or customers who are using our products, they see, drastic improvements?
There's quite improvement on the health with cardiac rehabilitation. It's the AHA research done. It shows it doubled the chance of a patient living for 5 more years. The reason I'm bringing up HA is because they have a most majority data they collect. Healthcare company is hard to have such large scale aggregation of data to show things like at that scale. But that being said, definitely have our data show quite some improvement as well. But I just want to bring up the HA data first, so that because that's more, how do I say? They have the more data and more quality data there, and they collecting data for, probably 20 years, 30 years. So I want to bring that up front. And that being said, inside our program, we also collect our data. And based on our data, it shows huge improvement. And it reduced hospital readmission rate by 30%. It also, right now, only like in regular traditional cardiac rehab program, only about 25% patients participate cardiac rehab. But by using our program, some of our patients see 50% increase in their patient enrollment into cardiac rehabilitation program. And I can send those number to you offline and as well to collecting more data. But I can see is it has, quite improvement on the patient enrollment percentage, as long as the hospital readmission rate reduction. So we are doing pretty good on those two metrics.
I have no doubt. I mean, any extra thing to use to monitor your heart, it's going to definitely give you some added advantage. So I have no doubt that you guys, your program is really, really efficient. I'd imagine that you should have maybe some case studies on your site or somewhere that if someone is listening, they could go and take a look. Or is there anything?
Yeah, there's a good case studies on our website. I mean, if anyone interested, there's a patient, journey and interviews there, along with some studies that we published, along with some, if I remember, is VA Atlanta. We published a couple of papers there with some veterans cardiac rehabilitation research program. We did a research with Allegheny Health Network. All of those case studies shows really good result and it's being published, and everyone be able to see those paper and outcome if they do some search.
Do you have any major competitors in the space?
I think we see ourselves as a pioneer in this domain, but we do see some newcomers to this space. But instead of paying more attention to the competitors, what we usually do is just focus ourselves, keep improving, put energy on the patients and programs rather than the competitors. And that's, I think, is better use of our energy, and that give us a lead in the space, rather than checking out different competitors and more about that. Mm-hmm.
Yeah, great answer. That means you guys are leaders, not followers. You're driving definitely innovation and development in this space. So where do you see this space in the next 10 years? Do you think they're going to be a lot more companies like yourself, or you how do you see the space in the next 10 years?
In the next 10 years, I think in this space, I see there will be home-based cardiac rehabilitation going to be widely adopted, as not just a couple of insurance companies that are working with. They're going to be widely adopted by all the major insurance companies, along with the government insurance, so that patient can comfortably enroll into home-based cardiac rehabilitation program without worrying about too much about payment, things like that. That being said, I think traditional cardiac rehabilitation will still exist, but only in major hospitals with limited capacity. Because some patients prefer center-based rehab, some patients prefer home-based. With people probably living in the highly populated population density area, they may choose the option to go for center-based cardiac rehabilitation. But I think overall, most majority people will choose home-based cardiac rehabilitation for their recovery. So I think that's gonna be one thing gonna happen. And second, I think what gonna be another trend is, in terms of rehabilitation, it's gonna be more diverse in the sense of someone has, it not just be focused on just cardiac, just obesity, just, diabetes, patient going to get a round-up care solution. And the way to do it is, company like us, we're going to focus on cardiac as always, but we're going to be able to collecting more data from a network and sharing more data from a network that different companies are focusing on different disease and doing the treatment at home and collecting data. All those companies going to share data into a network, and all of them going to be able to download the data that's shared by other companies so that they can provide a more rounded up solution for the patients. To the cardiac patients, they can get, even more education content that they're interested in, probably, diabetes, things like that. They're going to get a better diagnosis and treatment because the care team has more source of information, not just from one company, but from other, companies. That would be something I think going to happen for sure in the future. Different companies work together to provide the best care for the patient.
All right, Shuo, that's great, man. That's great. And I know that your company is doing extremely well in innovation and helping with that in the betterment of patient outcomes. So that's fantastic. I can't believe we're at the end. We could go on and on, but I want you to, someone is listening. How can they reach you?
If someone wants to reach me, I'm not a heavy social person, but the one I use currently most is LinkedIn. If someone interested to reach out to me, feel free to reach out me there. I'm happy to talk further if you guys have good initiatives. Always open to talk there.
Right, and also listeners, you can always go to movinganalytics.com and learn more about Shuo and his team and what they're doing to improve healthcare. So, Shuo, thank you so much again, sir, for being on the podcast today. We learned a lot about what you're doing and the advancement and how you're helping people with cardiovascular disease. So, until next time, thank you so much.
Thank you.
Thank you so much for joining us today. I hope you found this information useful. So please go to our website at yourcompanyhealth.com for more, and also like us on and share this episode on social media. We'd love for you to leave us a review on wherever you get your podcasts. Until next time, see you then.